All for giving me this opportunity, and I am Pankaj Mathur. I live in Jaipur, and I am an IIT Delhi alumni. Work with UNICEF, United Nations Children's Fund on water and sanitation area, and my journey actually started with this disease in 2017 when I was first identified with a painless lump, which Dr. Jyoti said, which was identified by in my right calf muscle, which was removed locally in one of the hospitals in Jaipur. And then it was identified as soft tissue sarcoma. Specifically, they identified as myofibroblastic sarcoma. Unfortunately, because the one thing which I really did very well in terms of following up on the after surgery scans with the disease every 3 months. So after 1 year and 3 months, I identified that there was a metastasis in form of two lung nodules in my lungs, and that was the time when I was actually recommended to Dr. Jyoti Bajpai by the local doctor. They said that she is the best, not just in country but probably in the world in terms of dealing with the soft tissue sarcoma and these kind of cases. Because the doctor here was very, he was very open and very lovely in terms of accepting the fact that if we see a sarcoma patient in 10 days, probably Dr. Jyoti would be consulting almost 100 cases on a daily basis on such things. So first of all, I didn't even know that this is a rare case, and I knew throughout that yes, this is a rare disease. But when it was identified, I didn't know that this is a rare cancer. And in terms of my own cancer literacy, I came to know that this is really a rare cancer. And today there is a number associated to that when it was said that six in a million. So I really consider myself really one of the rarest ones to be there on the earth. But my journey with Dr. Jyoti really has been fantastic, and she has been so lovely in terms of interacting with me, with my family. When she said that the integrative care is important, so it's not just
important thing I would tell a patient when they are diagnosed is no fear, no panic. Cancer is curable. You need to get the right treatment. Whatever stage, today we've got very good. Of course, as she said, the larger the tumor, probability of success drops. So we want early detection. Many cancer, and I'm telling you this after 35 years in the field, 40% of work I do is redo work, second opinion work. And I don't think any patient should be put through stress, emotional, psychological, financial, by not getting the best treatment first. So if I had to give one message, no fear, cancer is curable. Choose your right doctor, choose your right hospital, and go get the best treatment. And today, we have the best treatment in our country. There's no need of flying abroad. Everything is available here.
I agree with you.
We can give medical care, but creating awareness, we need y'all. So I'd see y'all in functions like this and then y'all disappear. But we've got so many important days in the calendar and the year. We have World Cancer Day, World Tobacco Day, we have a month for breast cancer, we have a World Head and Neck Day. And I think you all need to put that news out in the press regularly. Awareness. You have awareness, people will prevent cancer, they'll come early, and they'll get the right treatment, and we'll have many more survivors amongst all of us. Success stories, warriors like the 3 who are here and the 2 who are online.
Can I say something?
One more thing we do when it comes to the physician, family physician and all that. I think expert like Dr. Cruz or Dr. Jyoti, they do involve family physician for awareness and their knowledge enhancement as well. So we are doing so many programs where we exchange that information to the clinicians, where they can help to identify. And as rightly said by Sir, role of press is important to communicate all this important is and make awareness.
Hello.
Man is saying acceptance. I think once you accept and when you create that you don't have to panic, I think you will get the right guidance. So yeah, I was lucky enough that I was having one doctor in my family. But if you accept that you have a cancer and you will not panic, I think you will search wherever you want on internet, and there are so many places where you can see that what is the best hospital where you can find the expert, and then you can meet the right doctor. So I would second, sir, that don't panic, acceptance, and then yeah, you have to be very careful when you are choosing your doctor as well as the hospital for treatment.
Actually really work with me is that, you need to count your blessings, that you may be having cancer now, but how your life has been. You have been always through some kind of blessings, but this is the tough time for which you need to go through. And then second thing is already pointed out that, you need to do some kind of research at your level to identify that, where the best doctors would sit, because, and then it becomes really very important in case of, rare cancers. Because as I already said, in my case, in my first instance, when I had my first surgery, I didn't even know that this is so rare. But when there was a metastasis in lung, I really do a lot of research. I spoke with a lot of people. I went to a lot of, number of hospitals in Delhi, Mumbai, consulted people internationally, and then came to know that, the best doctor in India would be sitting there in Mumbai in form of Dr. Jyoti Bajpai. And then go there and then follow with her your disease. As far as the patient's perspective is concerned, I also believe that the family support is really very, very important, because you cannot fight this battle alone. Your family has to be there with you, your doctors have to be there with you. And as Dr. Jyoti pointed out, Dr. D'Cruz pointed out, it's not just about one doctor. Team of doctors has to be there. There has to be a surgeon, there has to be an oncologist, there has to be a radiation specialist, there has to be a pain specialist in your team, so that when you really go through the pain during your treatment, people should be there to advise you the best treatment out of that. And then last and most important thing with the patient's perspective is that, which I keep on writing at many places. I've written it in my workplace, I've written it in my bedroom, everywhere. This too shall pass. It means you had your best of your times in your life. It has passed. It has not remained over there. You are going through the difficult part of your life. You are going through a different disease, a difficult disease. This too shall pass, because you are in the best of the treatment. You are in best of your families. You are in best of your support systems, and you know that what is to be done. So this too shall pass. I have been fighting this disease for almost 7.5 years now. And but my association with the disease has always been like that. I have never considered it as my enemy, but because cancer cells are also part of your body. These are those naughty cells who have not been behaving the way you want them to behave, but they are always part of your body. The last thing which I actually wanted to point out is the importance of the follow-ups. I think one of the speakers said that your treatment is over and then you feel that you are a free bird now. No, please. You need to go for your regular follow-up PET scans or maybe CT scans as prescribed by your oncologist, your doctor. That's very important, because in my case, I have fought it 4 times. 1 principal tumor and then 3 times metastatic tumors. And I was able to find out in an early stage, just because of the fact that I have been doing 3 months kind of follow-up with these with this kind of scans. And then I come to know that there is a trouble. And I really contact back Dr. Jyoti Bajpai. Even if I have a normal report, I really contact back Dr. Jyoti Bajpai and then ask her that what can we do for next 3 months. So this is the follow-up, which is really very, very vital, very, very important for a good quality of life, and also keep a bit of control over your body and disease, that what is happening with your body. But thank you very much, and then I'll take leave because I'm in Rome. As I already pointed out, that I made it a point that every time I clear this 3 months examination of mine, I try to celebrate. So this is just part of my celebration, that I'm with my family, in Europe, and then I'll come back in India next couple of days. So thank you very much for giving this opportunity, and I'll take leave now. Thank you very much.
Thank you, Mr. Bhatt.
Am I
Yes,
audible?
Rita.
Yeah. So congratulations, Dr. Jyoti, and all the Apollo Hospital staff for launching this very good clinic. On behalf of caregivers and family members, I want to speak 1 or 2 sentences. As Pankaj said, rightly said, for the patient, family is a great support. So when family comes in the picture, during the hospital visits and treatment, we family also feel very happy that he's under somebody's care. But when they come back to house, or when they are with us, family, how we have to continue with the care what doctors has given. So this is firstly, the family has to be very positive. And here I may sound a little bit rare, but I think with my experience, I'm a dancer and I'm a writer. So I do feel that personally, I don't take it as a fight or a struggle or a war, because that follows the word win, defeat, which is the very negative for me. So I think managing the situation is the best word, so that I will get up every day. Oh, yesterday I managed it very well. My husband managed it very well. Today also we will do that. We will be very confident and we will move on in life. So we do go for a normal walks. We take a camera with us. We take photographs. We eat together. And one more thing is, when there is a I want to tell one thing here. Multidisciplinary means diet and nutrition also. So Dr. Jyoti has referred to us to Dr. Varsha Gore, who is there in the Apollo, and she gave us a diet chart. So this diet chart will start before your therapy and after your therapy and during your therapy. Three parts. So you follow that, and what happens to your family, it will be a 360 degrees change. You will be eating so many vegetables and fruits, and you have a kind of restriction. Does it make you unhappy? No. What I am trying to do is, I will select the vegetables already in the chart, and I will go to each and every of the states of India, what they are preparing with that, so that I can prepare good food, nutritious food. I can try good recipes with all these restrictions. So this means I do not want to feel unhappy in this situation, so that I make myself more happy, and I will learn each day with my husband also. So this is why multidisciplinary is very important, because this helps the family to learn more and be positive and be very creative what we have in this situation. So that is the very important, that is family should be there, and family should be a little bit educative. Sometimes we nag, every doctor is asking too many questions, that's there, but while learning it, when we know the situation, it will be very easy to talk like this in front of everyone, not to hide. Because once Dr. Jyoti also said, it is a social stigma. So social stigma should not be, because how much we come out and talk about this, it will go away one day, really. So I thank everyone and all the best. And madam, thank you so much for being with always being with us in physical consultation and also teleconsultation on the time, and keeping that schedule for everyone. It helps a lot. And thanks for your team, all your team in the medical oncology department, and also Dr. Ranjit Vajpayee, onco radiology department, and his team, Dr. Varsha Gore, a nutrition and diet, and her team in the Apollo. And we thank all the Apollo staff today and who were there with us always. Thank you so much. All the best, madam.